13 upgraded and extended units were opened at the Mamelodi Regional Hospital today. These include an eye clinic, outpatient department and mental health unit. Health Minister Joe Phaahla and Gauteng Premier Panyaza Lesufi toured the facility. Government is on a mission to improve public health service delivery amid the backdrop of shortages of both electricity and water. eNCA's Heidi Giokos was at the hospital earlier and joins me in studio now. Heidi, tell us about these upgrades. Government saying it's important to improve services.
Yes, certainly, Annalie, and I think people watching are probably saying, oh, it's just another hospital, it's just another upgrade. But this is quite significant. And I think the reason for this is because all that you are seeing now, there aren't many visuals, but about 13 units have been revamped. And we know that this costs 9.5 million rand. Now, the Health Minister, Dr. Joe Phaahla, together with the newly elected Gauteng Premier Panyaza Lesufi, indicating that had it been any other time, the SIU might have been involved. This project might have taken years to complete. It might have cost hundreds of millions of rands to complete this, but this costs 9.5 million rand. And the Health Minister saying that government needs to do 10 times better. And this revamp that you are seeing at the Mamelodi Regional Hospital should be an example for other hospitals that need to be revamped or need to be extended to provide services to possibly the most vulnerable in our society. The Premier indicating also that government officials oftentimes don't use these public hospitals or these public facilities because of the state that they are in. Many times we've spoken to South Africans who've said, I will not step foot into some public hospitals because I'm worried I won't come out alive. And the Premier and the Health Minister saying they are trying to change that narrative and trying to change that experience for South Africans to say you are safe, you will be helped, there are proper services and facilities at these public hospitals. I want us to listen to what the Health Minister, Dr. Joe Phaahla, said about the infrastructure and how it is possible to build and revamp these hospitals at a very low cost and not exorbitant budgets that we are normally seeing when these revamps happen. Let's listen in on that.
It can't be right that government spends so much and gets so little. Infrastructure is just the worst in terms of how much government spends and gets so little returns with poor quality. So just in just this morning, I think, Mr. Takela, if you didn't believe what I've always been saying, that we must stop this. We must stop this, kind of, almost fruitless expenditure in the sense that we're being exploited, in that we spend billions and millions and with very poor outcomes. We're being ripped off.
Heidi, despite the number of facilities who have been exempted from load shedding, both load shedding and shortage of water remain a huge challenge for healthcare facilities.
Yes, certainly. It's a massive problem. We've been seeing many hospitals coming out and saying we are in desperate need for hospitals to be exempt from load shedding, but also water cuts and water restrictions. We do know that water cuts have been implemented, especially here in Gauteng, because of the load shedding. And we know that two main hospitals in the city of Johannesburg, Rahima Musa and Helen Joseph, have been crying out for help. Doctors saying they're getting sick, patients are getting sick, cleaners don't know how to cope because, and I'm going to get graphic, feces is basically running in the corridors of these hospitals. It's completely unacceptable that these hospitals have to subject themselves to this state. But according to the Premier, he's had extensive meetings, including this morning at 6 o'clock in the morning. He says that he believes that this will be sorted out as soon as possible. We also asked the Health Minister about the exemption of hospitals, and they are trying to increase that list. Luckily, load shedding has been suspended for now. I need to find as much wood as possible to touch wood, because every time we think there's going to be no load shedding, we're told 2 days later that there is going to be load shedding.
But Heidi, also just take a breath and know that this is once again because of reduced demand over weekends. So come Monday, there is likely to be load shedding again. I'm sorry for the bad news.
Thanks for the reality check. But hopefully this will alleviate some pressure on these hospitals, because they really are struggling. But the Premier says they're trying their very best to sort it out. Let's listen to what he had to say about those issues.
One session with the senior leadership of the department. I must say it was a heart-to-heart. When we left there, all of us accepted that we have a huge challenge. And I'm saddened when you quote doctors say they might get sick or they're getting sick. You can imagine patients, and you can imagine people that are even scared to come to our hospitals, because the major part is not people that are within hospitals. There are those that are scared because they think our hospitals are not fit to assist them. So with the team and what we have just resolved this morning, I remain hopeful that all those particular matters will be attended to. Yes, it might take long, but at least there is a political will. From my side, I said to them, no one must say we don't have money to do this. We'll protect health and we'll provide the necessary financial assistance that is needed for the health department in Gauteng. But it must not be a bottomless pit where you just throw money and the problem still remains. So we're working on those mechanisms, and hopefully those hospitals will be self-sustainable as well.
Heidi, just coming back to what you said a little bit earlier about cabinet ministers often being hesitant to attend public health facilities themselves because of the state they're in. Did you have a chance to ask Minister Joe Phaahla specifically whether he would be willing to risk his health care at public healthcare facilities?
The answer is probably yes, I would go to public health care, but is that the truth? No, that's not the truth. We've seen it oftentimes where cabinet ministers, government officials do not go to public facilities because of the state that they are in. And that's,
well, they don't have to when they can travel overseas to get the best medical care.
Yes. And it's shameful, Annalie, and we must say it as it is. It is shameful that you have government officials that are supposed to be looking after these public facilities, making sure that they provide the necessary services, making sure that they're on the best condition, and oftentimes they are not. And the Gauteng Premier today emphasized that and said that it's unacceptable that you have an elderly woman standing in a queue from 6 a.m. in the morning or even 4 a.m. and only being helped at 2 p.m. in the afternoon, and oftentimes they get turned away because they are last in the queue. And the Premier is saying that needs to change urgently, and it's not just here in Gauteng, despite the fact that there's a huge healthcare crisis in this province, and that needs to urgently be addressed. It's something that happens across the country, that these issues are not being addressed, and government officials are often not in public hospitals. You will not see them queuing in a public hospital. So how do they expect citizens to do this? So hopefully this will change. I don't know if it will, but
well, perhaps that's something, another amendment we can suggest for the cabinet minister's handbook while we're looking at revisions.
Yes.
Thank you very much for that, Heidi
Sure.
Giokos, bringing us that update.